It's dangerous for our patients. It's dangerous for our members, paramedics, communication staff. We're not just feeling emotional danger, but the psychological danger as well.
Workers at Ambulance Tasmania are headed for industrial action after stalled negotiations with the government. We're joined by Jan, a paramedic, for this HACSU vodcast. Before we get to the negotiations, Jan, what is it that is happening on the ground at the moment, the reality of it, day in and day out, that perhaps the Tasmanian public we're not aware of?
On a daily basis, the community has a single officer rock up to their house. They've called for an ambulance, they see an ambulance with a stretcher, and it's a single officer. Daily basis, the first question people ask is, is there only one of you? And this is a massive issue. I've spoken to people from other services, I've spoken to people internationally, and they cannot believe that Ambulance Tasmania supports a single officer responding to a case, and then because it's so urgent or they have no other resources, getting the patient in the back and driving to the hospital rather than waiting for someone. Patients are being really poorly looked after. We're giving them the best that we can, but the best that we can isn't really the best that we should be doing. So your question was, what are we seeing? We're seeing single officers, we're seeing short staff, we're seeing people not getting their meals, we're seeing people finishing late. And this isn't an exception. This is every day.
That sounds dangerous.
It's dangerous for our patients. It's dangerous for our members, paramedics, communication staff. We're not just feeling emotional danger, but the psychological danger as well. And it's one of these things that these elements all build up, and it definitely has a physical effect on people. And it is dangerous for the rest of the community. We just want to see an end to this sort of thing, but the fatigue is a problem. It compounds, and without enough time to decompress, members are left struggling, and it's going to boil over. We're seeing more and more people just throwing their hands up saying, I've had enough.
I've spoken with staff all through all the different areas of Ambulance Tasmania, and I think it's important to recognise it isn't just on the ground staff. I've spoken with people in your communications team that can't get a bathroom break. They physically can't walk away from the phones.
I can tell you it's happening, and it's happening all of the time. And I don't agree when the government says we're doing everything we can. I don't agree that the government says we've staffed lots of positions, we're funding people really well. What we see is that you're not. We see that people are struggling. We see that we're not getting the rosters that we want. We're not getting downtime. We're not getting time to do any learning. These are all key indicators that there's failures in the system, and those failures then fall back onto the general public.
So in this negotiation process, which has stalled with the government, what are some of those key things that you're fighting for that the government just won't agree on?
When we put together our log of claims for the enterprise bargaining agreement, we had a whole list of things that everyone looked at and went, wow, that's pretty reasonable. We're not asking for spa baths in every station. We're not asking for 8 months leave a year. The things we were asking for were reasonable. And you know what? I've been a part of 20 plus meetings over the last 10 months as a part of the bargaining team. All we're hearing right now is, that's going to cost too much. The government can't afford that. Well, you're going to have to make sacrifices somewhere else. But we're not being unreasonable. It's been years and years that this has been building. Your question is, what are they ignoring? What are they saying no to? Pretty much everything. There's still a lot for them to improve on, and that's why we need to keep negotiating.
How does it feel with the government not coming to the table? What's the general consensus on the ground?
The way that we feel is huge frustrations because the members are being punished because the government took so long to make a decision, and now they finally have made a decision. They're telling us, well, you've got to take this offer, or then we're not going to give you back pay, or we're not going to give you these conditions. So they're holding our members to ransom because they took so long to get this done. And that's not fair. That doesn't pass the pub test, does it? And the people that I speak to, all of them say, that's not right. That shouldn't be like that. So that's what we're working towards fixing. And that's where our strong union can bring that together. If we all stand together, we're going to be really successful.
And what industrial action are you prepared to take?
We're starting with some heavier bans. We're already looking at banning overtime in certain areas. So every area around Tasmania, staff are refusing to do overtime. We're looking at how do we stop single officers having to respond. We're acknowledging that there are many, many contracts that Ambulance Tasmania has with other providers, and they can't find staff for it. So where are they getting staff? They're taking them off-road. So our public is missing out on care because Ambulance Tasmania have committed officers to a paid event somewhere else. An ambulance needs to do better. And the sort of things that we can implement are, let's make it harder for the government. We're going to say no to these things. We're going to support our staff in saying no to certain things. So the more time goes along, the stronger our resolve will be, and the more significant our industrial action will be as well.
If the Premier and Bridget Archer, the Health Minister, were here right now, what would you say to them on behalf of those members?
Words only count for so much. We're really going to judge you on your actions. And so far, your actions haven't showed that you care about us. They haven't showed that you care about the community. So I would implore them to do better. And they can, and they should.